The term patient centricity has lost much of its power today. The concept of putting the patient first has taken the form of a buzzword, and the term has been overused or even in some cases abused to the point where it no longer holds any meaning. And I'm not the only one who is seeing this or even feeling this. Many in the industry we speak to agree, of course to varying degrees, that there is much more to be done in this space. And I think we need to push the boundaries past the tensions of the current status quo and into a state of inspired ambition to be more person-centered. And I mean person-centered instead of patient-centered. And let me tell you why. Person-centered takes on a more holistic approach. We need to understand that improving patient outcomes doesn't always necessarily mean that we are being patient-centric. And here's a common example. So, through treatment, we could prolong the life by months or even years of a person living with cancer, but quality of life could potentially decrease. Our industry's focus on biomedical intervention is not enough. We need to expand and envelop the whole person. We need to delve into people's motivations and aspirations and to account for quality of life and the social determinants of health to really better understand patient realities and their lived experiences. So today, we're seeing pharma viewing patient goals in terms of clinical outcomes. Should we really be viewing and defining patients solely on a disease or a condition? There is a shifting attitude towards involving patients and ACPs as core contributors, so equal partners towards future solutions, whether it's within pharma's functional objectives or an overarching company-wide level strategic objective. And there is a business case for this. So really, how better to future-proof an industry by involving our customers? And by customers, I mean both patients and ACPs. By being person-centered and accounting for these often analytically messy insights, we can really drive better solutions that are relevant and meaningful for patients. Not only does this build trust among patients and patient communities, something we all know that can be very difficult at times, it effectively audits our solutions and motivates patients to continue to re-engage in the work that will ultimately affect their lives. Today, this change heavily relies on qualitative research of a kind that pharma is generally uncomfortable with. We find that pharma isn't using the right tools or bringing in the right expertise for patient engagement and to really understand the context of vulnerability that many patients experience. Today, patients often feel as if patient engagement is being forced on them, that we come in, get what we need, and then disappear with often no follow-up or how their contribution has made an impact. And by bringing it back to the concept of person centricity and by focusing on what really matters to patients, and this is often about health-related quality of life, we can then begin to build back the trust and create meaningful symbiotic relationships with the patients and the patient community. So here's the provocative question I'm asking. Is this even our job? I've heard both sides of the story, and I'd love to hear your take. Do you think being person-centered versus patient-centered is the way forward? And can you build trust among patients solely by focusing on clinical outcomes instead of expanding it into quality of life?